the risk of a catastrophic biological event has ever been increasing in the past years. And this is largely because of we are becoming a one big village, so globalization. Secondly, there is increased movement and travel of both humans and animals. And fourthly, the increase in biotechnology and science itself. Unfortunately, this has happened at a time when most of our member states do not have the necessary capacity and capacities to deal with such catastrophic events.
Biosafety cabinets are critical in ensuring the safety of our staff, patients, and the environment. However, the cost of servicing and maintaining them is very high due to the limited availability of local experts to service and maintain them.
BSL labs are critical in ensuring the safety of our staff, patients, and the environment. However, the cost of servicing and maintaining them is very high due to limited availability of local experts to service and maintain them.
In response, the AfricaCDC, together with member states and some of its regional and international partners, came together and launched the Biosafety and Biosecurity initiative. Now, this initiative's main goal is to capacitate the member states such that they can be able to comply with many of the international and national requirements and regulations that most of them have attested and signed to. And these include the International Health Regulations, the Biological Weapons Convention, the United Nations Security Council Resolution, Special Resolution 1540, and the multi-country Global Health Security Agenda. The initiative is being implemented in 5 broad categories, or 5 priority areas, based on the feedback that we received from the consultations that AfricaCDC has conducted in the last 3 years. The first priority area was to establish and operationalize regional biosafety and biosecurity technical working groups. Now, these technical working groups are multi-expert, multi-stakeholder, and they are tasked with monitoring and coordinating the implementation of the Biosafety and Biosecurity initiative across the region. The second priority area is the development and establishment of a regulatory and certification framework for institutions that are handling high-risk pathogens. It is unfortunate that at this juncture, as a region, we do not have regionally acceptable minimum standards for biosafety and biosecurity, that these high containment facilities that are keeping, storing, manipulating some of these high-risk pathogens need to comply to. This framework seeks to address that gap. The third priority area is the strengthening of our National Public Health Institute and the National Reference Laboratories, such that they can then be able to prevent, and where they fail, help us to detect in real time, and where we detect, be able to respond effectively and quickly to any potential threat. The other priority area is the development of a regional biosafety and biosecurity training and certification program.
La biosécurité et la biosécurité sont devenues très critiques avec l'avènement de la COVID-19. Il est très important que nous développons les capacités des experts dans ce domaine. Le programme dirigé par AfricaCDC pour former et certifier les experts en biosécurité et en biosécurité est arrivé à point nommé.
Les laboratoires génèrent de grandes quantités de déchets dont la plupart présentent un risque biologique pour le personnel, les patients et l'environnement. Les laboratoires doivent implémenter des procédures pour gérer les déchets de manière appropriée et sûre. Le programme de formation établi par CDC Afrique permettra de résoudre cette difficulté car l'un des programmes spécialisés porte sur la gestion des déchets biologiques.
This is the program that brings us to the launch today. We were tasked as AfricaCDC to lead in turning biosafety and biosecurity into a professionally recognized program. This training program that we launched today is a program that needs to be accessible, a program that is implementable in the region, a program that is implementable in a sustainable way, and a program that is regionally accepted and endorsed across the region. Now, you may be asking yourself, what are the unique features of this training and certification program that we are launching today? First, it is built and based upon international standards. A lot of research has been done, a lot of consultation has been done to ensure that this training and certification program for biosafety and biosecurity experts meet international standards so that our trainees, our graduates, can be accepted across the Africa region and even beyond. Secondly, the training combines both didactic, classroom-based training and field practical. It is important that we build not only the theoretical aspect of our participants and our graduates, but also the hands-on practical aspects to make sure that they are highly competitive across the region. Now, the structure of the training is such that it contains the first part of a 5 to 10 day didactic workshop based training. Following successful completion of this training, that includes also an examination which is hosted by the African Society for Laboratory Medicine Academy. Trainees then go into the second phase where they undergo practical competence evaluations back in their home country. This ensures that we also build the skills and competencies that are required for the several areas that are included into this training. Number 3, this training recognizes prior learning and prior experience through its alternative pathway. So there is indeed the standard pathway where you go through the 5 days, then you go through the field practical exercises. But we want to appreciate that a lot of training has been going on in the region. A lot of training programs are available in the region. We also want to recognize those that have gone through those trainings. What they simply need to do, put together their portfolio of their training and experience. They submit this to the Examination and Certification Council of this training program. They are evaluated and then they are placed accordingly in the level of competencies that have been designed for this program. Thirdly, it is structured in a way that allows incremental learning, incremental gaining of experience and expertise. There are 3 levels to this training program. The entry level, which is level 1. This contains the 5 to 10 day didactic training. Then there is the level 2, which is the intermediate level, where participants go back to their country to do hands-on practical and competencies. Here, they do work together with a regional subject matter expert to develop a research project that they are able to implement in their home country. In some of these, they are requested to conduct some certification, some maintenance of some of the biosafety and biosecurity equipment, more specifically our biological safety cabinet. And they do this under the supervision of a qualified regional subject matter expert. Following that, they then submit their portfolio to the Examination and Certification Council, and if successful, then awarded a level 2 or intermediate certificate. Then there is the expert level, where one has been on the intermediate level for at least 7 years with a lot of evidence, a lot of practice and continuous professional development. This incremental phase of training and certification allows for incremental building of skills in a way that is sustainable, in a way that is accessible to our member states. Now, the training is also offered at acceptable and regionally agreed regional centers of excellence for biosafety and biosecurity. Many of you in your countries will be requested to submit proposals where you may want to host one of these centers of excellence. As a region, we have developed regional centers of excellence for biosafety and biosecurity terms of reference, by which member states, those that want to apply, those who want to host any of these centers of excellence, can indicate as such. Through our technical working groups, we've been working tirelessly to establish these centers of excellence, such that following this launch, there will be implementation of this training program in second quarter or third quarter of this year. I am pleased, and on behalf of AfricaCDC, we would like to thank all the member states whom we have worked with in the past 18 to 24 months to thoroughly review and develop this regionally acceptable training and certification program.